Good morning.
Good morning, Madam Chair.
Good morning, Senate Finance and our guest. Today is Friday, April 7th, and we have several lists in front of us for voting. I think we're going to start with the blue concurrence or recede document, and we'll start with Patrick. Good morning, Patrick.
Good morning. So it's back before you is the Senate Bill 90 Stop the Spam Act. The question was whether to reconsider the committee's decision to not concur.
I would ask that we reconsider and the motion and move to concur with that.
So, and the difference that was discussed yesterday is that provision that would exempt the non-commercial telephone solicitation for the purpose of public opinion research. You know, the House took that exemption out for those organizations, those entities.
Okay, I had a motion to reconsider the vote by which we voted not to concur with the House amendments. There's a second. So seeing no questions, all those in favor of reconsidering the vote and bringing the matter back before us, raise your hand. Okay, that's unanimous. So we now have before us.
I actually didn't vote to reconsider.
Oh, I'm sorry. Did I miss? Oh, those opposed, please raise your hand.
Only because I know we're going to change it.
Okay, so that's two. So sorry about that. That was a 9-2 on the reconsideration to bring the bill back before us. So we now have Senate Bill 90 before us. With the question is whether or not to concur with the House amendments.
And I will move to concur with that.
Have a motion and a second to concur with the House amendments to Senate Bill 90. Is there any questions or discussion? Senator Reedy?
I'm not gonna belabor the point, except can I just ask, did we get any additional clarification or is it going to be Gallup poll can no longer do automated polling in Maryland if we pass this bill? I'm using Gallup as an example. They probably do live dialers, but live phone calls. I'm just curious.
Yeah, I mean, I don't know whether Gallup is a not-for-profit organization. If they are, you know, they would be covered under the exemption that isn't another part of the bill. But if they're a for-profit polling company, you know, then that would impact them, I would think.
Or if they're just they don't have to be nonprofit. It could be if you're a community organization. I guess you'd be a nonprofit then, wouldn't you? Okay, all right.
Senator Mounts?
Yeah, just want to check because I supported the bill in its form, but now it's been changed with those House amendments, right? And the House amendments have those include the groups that were excluded originally. Is that accurate? Well, that's what we're voting on right now, right? Yeah,
Sure.
Yeah, because I support the bill and I want the bill, but with the way it's been changed, I probably won't vote for it, unfortunately. I don't, you know.
Okay, I'm going Senator Kramer, then Senator Guile.
Yeah, I just wanted to say to Senator Mounts, the bill as introduced did not have that language that we are discussing at the moment. So that was a last minute amendment that was added in this committee. So it did not, and that's why the House version, when it came to us, did not have that language. This was a very late amendment request that when I received it, I looked at it, had some conversations with the House sponsor. We concluded that it would not do harm to the bill. We didn't, you know, the impression was we didn't think it would do harm. There was only one interest that brought this to my attention. And in light of, you know, our determination that we did not believe it would do harm to the bill, I brought the amendment to the committee at the voting session. We adopted it. When it went over to the House, the committee chair there said he was not comfortable with the amendment that we had added on. They took it out. So I will share with you, as introduced, the bill did not have that language. So it basically returns the bill to the posture it was in when we had the bill hearing.
For a matter of expediency, I'm gonna vote in favor of the bill, but I reserve the right to change my vote on the floor.
All righty then.
Always, thank you. So Senator Guile, then the Vice Chair, then Senator Vital.
Thank you, Madam Chair. So do we still have the exception in there for political, religious reasons? Is that's still in there?
That's right. So that's there's an exception for a non-commercial telephone solicitation for religious, charitable, political, or educational purposes when that entity is a not-for-profit.
Okay, so I guess what I'm thinking is like, what if we have like a consultant, for example, that's hired by a political campaign? Is that consultant, I mean, considered it's not like a nonprofit, right? I realize that ultimately like the campaign committee or caucus committee is the one paying the consultant, but is that consultant it's not a nonprofit, right?
Well, the exemption says that the way it reads is that a person soliciting for non-commercial purposes on behalf of one of those organizations is exempt only if the person is soliciting for a non-profit entity. And the
Oh, okay.
entity is registered
Okay.
as a nonprofit.
Okay, so then consequently, a candidate or caucus or committee, whatever the campaign committee would be considered and not, they're soliciting on behalf of.
Right.
So
yeah.
then that would be okay. Okay,
Mhm.
all right, thank you.
Thank you, Madam Vice Chair.
Yeah, I was just looking up to see if the Gallup poll was a nonprofit, but I'm getting mixed messages, just like we've all had mixed messages here. One says yes, and one says it's a market company, so I have to rescind my statement.
Thank you. Senator Vital.
Madam Chair, this might not be a perfect bill, but we've got to help our constituents with these spam calls. And so sometimes, you just have to vote a bill and come back and maybe make it perfect next year. But our constituents are so tired of these phone calls, and I don't want to be the one that's voted against this. And then we're going to hear about that. So thank you very much.
Thank you. Back to Senator Reedy.
I wanted to clarify for the record, I've mentioned Gallup a couple times. Gallup does not have a lobbyist and they have not communicated with me. I was using them as an example. And first of all, it sounds to me like the way the bill's written, if Gallup is doing something on behalf of a nonprofit, it's okay. The question is though, candidates, we're not nonprofits. Friends of Justin Reedy is not a nonprofit. It's a campaign finance entity. So now it's not taxable either, but it's a campaign finance. You don't get a charitable deduction for contributing to our campaigns, but I hear what Senator Vital is saying. I think I may abstain on this vote because I'd like to get a little more research. I'm certainly not wanting to vote against, spam call. I definitely agree the spam calls are bad and we want them to stop. So anyway, I think I may just abstain on this committee vote and then try to find some more
You
information.
have to be registered as a.
Okay, Senator Guile.
Yeah, I agree with what Senator Vital is saying, that I do think people, our constituents are frustrated. I get frustrated about the quantity of spam calls I get. On the other hand, I do think that there are a lot of really good, whether it be Gallup or others, that do really good, research or other things based on some of this polling. And I realize that for the most part, they're probably being done for nonprofit purposes. I just don't know for certain if it's always that way, if there's not some situation where there may be for some sort of commercial purposes or something that this data or this research is indeed important. So I still have some reservations about the language of it. So thank you, Madam Chair.
Thank you. Back to Senator Reedy.
Well, we're going to vote it now. I think it sounds like, obviously up to you, Madam Chair. I'll reach out to State Board of Elections and just get a sense of whether this language would apply to, like, can a campaign finance entity pay for polling for, issue polling and, or I guess none of us will be doing any horse race polling in state Senate districts this year. So, we might be able to have a chance to come back. I just am a little concerned of passing a law and then finding out somebody does a robo poll that they've done 5 times in the last 10 years. And they find out, they broke the law. That's the only thing I'm honestly was concerned about. So if you want to go ahead and move forward, I'm going to abstain, but I'll go see if I can find out some information.
Thank you, Senator. So there was in the bill, just a quick question, Patrick. So market research is allowable or exempt depending on who does that research, right?
Right.
Is that correct?
Correct.
Okay. Okay, Senator Kramer.
I was just going to once again say, colleagues, this is a bill that attracted a whole lot of attention. There was no shortage of lobbyists involved in the legislation. And as you know, I mentioned, there was only one small entity that reached out and said, we're not sure whether this affects us or not, and said, could you clarify it? I certainly did not hear from any of the major polling firms. I didn't hear from Mason-Dixon or Gallup or any of these large polling firms expressing concern that this somehow would limit their ability to participate in the Maryland marketplace. Just this one, and I had never heard of the entity. And the issue was, you know, we're not sure whether this will or will not affect us, but can you add this amendment and then it'll be clear. And as I also mentioned, that was at the very last minute. So I'll just put that out there. Beyond that, I never heard a word. I'm assuming no one else on the committee did on this particular issue.
No, I think that's fair, Senator. I think though an issue has been raised and an
Sure.
offer from one of our colleagues to do some research, even though we haven't heard from other groups, the interest from members has been raised. And I think that's a question that some of us have and legitimate to have that answered, but he has offered not to delay the vote on this bill. So I'll entertain a motion on a concurrence with the House amendments. I have a motion and a second for a favorable to concur with the House amendments on Senate Bill 90. Any questions or further discussion? All those in favor of the concurrence, raise your hand. Okay, that is 10. Those opposed, raise your hand.
I guess I'm opposed to the concurrence, but.
Okay. That's 9, 1, 9 and 2. All right, so we'll concur. That's you're with no, that's 8-3. 8-3. Okay, that's 8-4, the concurrence. Next bill.
Next bill is Senate Bill 162, Maryland Aviation Commission duties, composition, and member orientation. This is on the concurrence list. So the House made some amendments to the bill. I actually have printed out a reprint so you can see what they've done. I'll walk through them. On page 2 of the reprint, the House strikes from the duties of the Aviation Commission mitigating negative impacts of local aviation and airport industries as informed by accepted scientific research on creating and maintaining healthy and livable communities. And then on page 3, this changes the information and advice that the commission must consider and has it so that they must consider other Maryland communities that have or are predicted to have potentially adverse health or community impacts from airport infrastructure and economic growth decisions. The House amendments also have the commission, they're required to consider the aviation, economic, business, environmental health, and community related impacts or any other impacts that the commission finds relevant to the decisions of the commission or the administration. At the bottom, in approving the members of the commission, the governor has to take into consideration the experience of an appointee in the aviation and airport industries, such that some commission members have directly relevant experience. And then on page 4, this orientation that each member of the commission must receive must cover the full range of responsibilities of the commission instead of just that one piece that the bill would have it cover. And then on page 5, this alters what the annual report must include. The annual report of the commission must include so that it's a summary of commission feedback related to health or community impact and how the commission addressed such feedback. And then these provisions here that are added in the general provisions article, this is the open meetings law. And what it does is it applies certain provisions of the open meetings law to the Aviation Commission, such like you'll see, such as posting on the web its agenda, minutes, and having live stream video of its meetings and improving meetings in a timely manner.
Thank you. Senator Lamb.
You, I lost my thing. I think we're comfortable with these amendments. These have been worked out with MDOT and also the second floor. I think everyone's generally in agreement with this. And I think just to make clear, because there's a lot of language there at the end of the reprint, even though it's italicized, and maybe council can kind of clarify this for us, even though it's italicized, this is the gist of it is we're adding the MAA commission to this long list of other bodies that have to follow these requirements. Those requirements already exist. This list of bodies already exists. This is just adding us in. It's appearing italicized because it's new to the bill, but not new to statute, right?
Exactly right. So they brought in a new section of the code into the bill, and it shows in italics because of that reason.
Right. So it's just there to bring in the Aviation Commission in concordance with like good governance, Open Meetings Act, that kind of stuff. Okay.
Senator Hayes.
So the italicized language, all these things, is it that the aviation board isn't currently doing these things, or they?
Yeah, they're not one of the boards that's listed here that's subject to these Open Meetings Act requirements that are in existing law. So what it's doing is it's applying these existing statutory requirements that are generally applicable to all these listed public bodies and bringing the Aviation Commission into that as well.
Right. So, but there are exceptions to the open meeting law. So like, if there's sensitive topics like procurements or stuff like that, and I don't know if this board is engaged in them, maybe they are, maybe they're not. There's exemptions that already exist in current law to the Open Meeting Act where they can meet them.
So this is just specific to this section of the Open Meetings Act.
Right.
And the requirements relating to the conduct of the meetings. Those other provisions of the Opens Meeting Law, they're not relevant to the amendments here. But this is the section of the Open Meetings Law that deals with how the meetings are to be conducted.
Right. Gotcha. Okay. And we still have the recommendations coming from the local elected officials, I think is Anne Arundel and Howard County, four of the 13. Right.
Yeah, that's unchanged.
Yeah, that's still a sticking point for me. I don't know of any other board that have that much input into. Typically, I've seen boards and commissions where the recommendations come from the presiding officers or being made by the governor. I thought when you're saying they're recommended, they're still appointed by the governor, but they're okay.
Yes,
Makes sense. Got it. Thank you.
Okay, we have the House amendments to Senate Bill 162 before us. I had a motion to concur. Is there a second? There is a second. Are there any further questions or discussion? All those in favor of concurring with the House on the amendments to Senate Bill 162, raise your hand. And it's unanimous. All right. That bill, those amendments are adopted or concurred with. Okay, that's it for Patrick. Turning to Nathan.
Next bill on the list is Senate Bill 396, which alters the voting membership of the Upper Shore Regional Council by removing the 3 Cecil County Commissioner positions and replacing them with the County Executive of Cecil County and 2 members of the Cecil County Council. So the House amendments make a conforming change to the non-voting members of the Regional Council. Specifically, the amendment clarifies that the other council members from Cecil County who are not the appointed voting members are non-voting members.
Second.
Have a motion and a second for a concurrence on the amendments to Senate Bill 396. Seeing no questions, all those in favor, raise your hand. And we unanimously concur. Next bill.
Next bill on the list is Senate Bill 801, which establishes the Cyber Maryland program within TEDCO to 1, create a talent pipeline in cybersecurity, 2, serve as a hub for state workforce development in cybersecurity, and 3, generally coordinate cybersecurity and research and innovation in the state. The House amendments authorize rather than require the governor to include an appropriation of $250,000 for the fund, and makes a conforming change to specify that certain funds shall be used for implementing certain U.S. Chamber of Commerce talent pipeline management approach only to the extent that funding is available.
Have a motion and a second to concur with the amendments to Senate Bill 801 as adopted by the House. I don't see any questions, so all those in favor, raise your hand. We unanimously concur with those amendments. Okay, that completes our concurrence calendar for this morning. So we're going to turn to the yellow voting list that you have in front of you, and David has a little bill that he's going to update us on.
Here you go. First off, by way of explanation, what you have in front of you, you see that the Senate Bill 516 is scratched out and replaced with House Bill 556. For ease of presentation, it's easier to work off this version of a reprint with changes to the bill made as a result of discussions between conferees, various senators and delegates, incorporated into this reprint in front of you. You'll be happy to hear that almost all of the Senate changes to the bill are still in here, but there's been some modifications, and I will try to go to those as quickly as possible without having to go through the entire bill again. So I think you all remember what this bill does. It sets a regulatory framework for the retail production, processing, and sale of legal cannabis in the state of Maryland. And one of the differences in the bill, if you go to page 17 of the reprint, there was a change here. At the very bottom, you'll see that arrest is struck and instead it's been replaced with possession charges. That's in 2 places. I would consider that a clarifying change. If you go to page 19 of the reprint, initially there was concern that a social equity applicants or HB2 folks wouldn't be able to participate in the social equity grant program. So you added a definition here to define who a social equity licensee is for participation in the equity participation grant program, which is an opportunity for social equity applicants to partner with existing licensees so they can get up and running in the cannabis business. This move, it was decided it might be better to define this later on in the bill. And so this definition is struck, and you'll see that it's going to be included in the general definitions under the law that would govern cannabis sale in Maryland. So that's a change there. And throughout the bill are various technical changes also that have been come up as people have been reviewing it. Also, the AG has been poring over this bill and they've come up with several technical changes. A lot of their suggestions relate to the issue of awarding licenses to social equity applicants, so you don't run afoul of constitutional considerations. If you go to page, let's forward to page 25 of the reprint. And go to the bottom, you'll see that repackages has been reinserted into the definition of dispensary because there was a lot of concerns about whether dispensaries could repackage cannabis, page 25 at the bottom. So repackages is now back in the bill as it came in. So the committee decided to go with just a definition for under medical cannabis, but to be clear, repackages is now part of the definition for dispensaries going forward once this bill becomes law. They can do it, yes. Let's see. I think that would be that. Let's go continuing on through this bill. Okay, let's go to page 28. And I mentioned before that there was a definition added under the partnership grant program for social equity licensee. It's been moved to the general definitions under the laws that'll govern the retail sale, production, and processing of cannabis. And at the suggestion of the AG, the definition is slightly tweaked to include dispensaries. So we're not focusing on just two elements of the process, but you have to bring in dispensaries to, again, avoid any constitutional considerations as you proceed forward with social equity applicants and all the benefits that they would hopefully get through the legislation. Moving forward again. Okay. This was an interesting topic. On the bottom of page 33, there was a language that you put into the bill that banned internet sales of cannabis. The consent, an agreement was reached, and we would say that the administration the newly formed Maryland Cannabis Administration would adopt regulations governing the internet sales of cannabis. And you should have another piece of paper in front of you with an amendment from Senator Griffith. And this gets at this issue about no longer banning internet sales. And you'll see that this will actually go on page 83, even though the directional language is for page 76. This would go, and what you have in front of you, it would be on page 83 under the general prohibitions. And it would basically say a cannabis licensee cannot conduct direct to consumer internet sales of adult use cannabis on or before July 1st, 2025. So they can't start any type of internet sales until after July 1, 2025.
Senator Hershey.
Thank you very much. And Madam Chair, thank you for your work on that. I know that was a big issue that we discussed yesterday. But just to ask, can we assume that that the commission will, we're now back to the administration.
It's going to be the administration.
Administration will be able to provide us some information on if other states have been doing this or how this works before. I mean, is this saying that it will go into effect there, or just saying really it won't go into effect? And I guess we would still be able to participate if we wanted to see something happen down the road.
You'll have at least another session before, this ban is lifted.
Right.
So I would imagine that if you request the administration, it will provide what information is necessary.
Okay.
About internet sales in other states.
Appreciate it. Okay. Thank you very much.
And you'll be able to have briefings and all the other good stuff, all the things you like. Okay, so on the next page, in the next couple of pages, actually, this is a lot of language that was added by the Finance Committee and the House and the Senate regarding the packaging material, using the materials for packaging, what shows up on the bottles. There were several changes here to make this a little more doable from a practical point of view. You'll see that there's new language on top of page 34, that there has to be regulations establishing health, safety, and security and tracking requirements for the packaging and repackaging of cannabis dispensary in accordance with the new section that was added in the bill regarding packaging materials and then the stuff and the information that shows up on the packaging. There's a slight change on lines 13 through 19 regarding the potency requirement for the administration to set potency requirements. And then you'll see the bill as it came out of the Senate specified that the packaging had to be entirely and uniformly opaque and may not. Apparently this is very difficult to do. So that was struck. And again, in lieu of regulations that would establish the process or the security tracking requirements, which is basically what they're doing right now through regulation. Child resistant packaging language initially had to conform to California standards. Instead, it's changed to conform with federal law requirements for child resistant packaging. If you go to page 25, you'll see there's very slight changes here regarding what statements have to appear on packaging that includes cannabis. And you'll see on line 7, this package contains cannabis to keep out of reach of children and animals. So animals was added by the group. Okay, so, and then finally, the change again, and with regard to the new standards in the bill that will deal with packaging and what goes on packaging. Apparently, a lot of medical cannabis folks right now have inventory with packaging that would not meet this requirement. So if you go to page 36, you'll see lines 8 through 10. The administration may adopt regulations to allow the sale on or before July 1, 2024 of cannabis products that are labeled and packaged using images described under. So it allows these folks to get rid of their inventory. It gives them a year to get rid of their inventory, so they don't get stuck with packaging that is currently legal right now, but would not be going forward. Let's go to page 37. Oh, no, this is a technical thing. Don't worry about that. We're going to fix that. Let's go to page. Oh, I wanted to point out one thing. There was a lot of questions on the floor. If you go to page 43, there was questions about how big the canopy can get in Maryland and how many licenses and all this other good stuff. If you read lines 12 through 17, you'll see that the administration has a lot of power here to set production, processing, sales, and other limitations and requirements for all the license types. It also has to issue dispensary licenses in a manner that encourage balanced geographic distribution based on population and market demand within a specified county, as well as cross-jurisdictional market demand. And then you also, if you recall, added language about clumping. So the administration has a lot of authority here to adopt regulations to prevent too much dispensaries or too much anything in any one jurisdiction. Let's see. Again, just to refresh your memory, you'll see on page 45, these are the total amount of licenses allowed going forward in Maryland at the top of page 45. No changes there. Oh, there was a change here. The group came to an agreement. If you recall, and you go to page 46 in the middle of the page, you extended the ability to deliver medical cannabis until January 1st, 2024. The group came to extend that another 6 months. And that's now going to be up to July 1, 2024. So if you're a medical cannabis dispensary and you're delivering under the bill as introduced, you would have to stop delivering on the effective date of the bill. This extends that for another year. So they could still deliver medical cannabis for another year. The rest of the language on the bottom of 46 was accidentally struck from the by amendment. Somehow somebody went a little crazy with their directional language when they were drafting it. So this brings back language regarding that a license is not property and confer property rights. And also if a existing medical cannabis business decides not to convert, they would no longer be allowed to operate as a cannabis business going forward and either have to sell their business or just have an inactive license. So it brought that language that should have been in the amendments you considered couple days ago and is passed by the Senate. Okay. Also, in the next several pages, there's really no changes to the laws to the what you sent over to the House regarding canopy and the like. However, there was a change. There was a definition. There were some changes offered by Senator Miles. Some of these dates actually affected HB2 licensees. So in certain cases, we had to go back to the original date of October 1st, 2022. I mean, where it didn't affect an HB2 licensee, it still stayed, the delay was still December 31st, but in a couple places we had to take it back. The group had to take it back to October 1st, so you wouldn't affect basically provisions that apply to HB2 licensees. Go to page 49. We're getting there. If you go to the bottom, there's a separate fee set up again for dispensaries. So there's no changes to the conversion fees for processors and growers, but you'll see at the very bottom there that each dispensary shall pay a one-time conversion fee of 8% instead of 10% of the total gross revenue, but no more than 2 million. So the $100,000 floor and the $2 million limit is still there, but it's going to be 8% of total gross revenues between those two rather than 10%. That's at the bottom of page 49. Actually, there isn't much. Let's see. Oh, okay. If you go to page 55, you required a report on micro dispensaries. The group added an interim report. So on or before January 1st, 2024, the administration shall submit an interim report on the micro dispensary safely and securely dispense cannabis, and then they'll have a final report on December 31st, 2024. So it adds an interim report to the report on micro dispensaries. There's a lot of clarifying language and then added to the bottom of the page as a result of the AG's concerns that the provisions related to the social equity applicants are going to be constitutional. So there's some clarifying language there. Let's see, let's go to page 60 of the reprint. There was language added here regarding zoning, the zoning capabilities of local governments, and it specifies again, it provides protections for existing HB2 licensees in the middle of the page that are not yet up and running. So it just specifies that if they're properly zoned and they're also one of these, then the local government can't take any more action against these than they could a normal business. Let's go to the next page on page 62. There was a change here regarding on-site consumption businesses. The Senate struck that a food service facility could apply for a license to operate an on-site consumption. This has been modified somewhat to a business that has an average daily receipt from the sale of bakery goods that are at least 50% of the average daily receipts of the business may apply for a license to operate an on-site consumption establishment. This is allowing folks who want to have an on-site consumption license and business and offer baked goods that would, whatever you bake into your baked goods. Oh, anyway, so that's a slight alteration there.
Senator Kramer?
Madam Chair, and maybe, so my question is within this section, where did we leave off with, and I'm looking at the notes here, is there any smoking of the product permitted anywhere indoors, or?
There is no smoking permitted indoors at an on-site consumption site.
None,
No.
okay, even in 50% bakery sales?
You'll see that an on-site establishment may not allow indoor smoking of cannabis or cannabis products.
And what line is that? I'm sorry.
That's lines 22 and 23.
Okay,
It's a
allow
pro-
the
it's a
indoor
straight
smoking of
prohibition.
cannabis or cannabis products on the licensed premises. So that's where it is a shall not, may not.
May
Okay.
not is in line 10.
Yeah.
Got it.
Senator.
Yep, I see it there. It's underlined. Okay. Okay, very good. Thank you.
All right.
Senator Reedy?
So I noticed here it says, you can't allow the indoor smoking. So that was a change in the conference. So it's saying you can smoke it right outside, like it could be a consumption site that would have a patio that would allow you to smoke or something. Is that the concept behind this, or?
I would say that might be the concept behind this. If approved by a local jurisdiction, yes. The local jurisdiction can always say no to any on-site consumption.
And is the goal of the rest of the statute is allow people to have consumption sites where there's food involved? That's the idea, it seems like, correct?
Baked goods, yes.
Baked goods.
Baked goods.
Baked goods, okay, all right. Can they have, oh, that's one more question, if I might, could these folks have also an alcohol license, or is that
They
not?
may- No, no
they may not.
alcohol, no
We're
tobacco.
restricting that, that's
Yeah.
not left up to the local, okay.
They may not allow the consumption of alcohol on the licensed premises, license 15 through 16.
Senator Kramer.
So real fast, it says a business that has average daily receipts, et cetera, of baked goods may apply for a license to operate on consumption. Is that an application at the state, or is that the county where you're saying a county has the ability to say no, thank you?
Well, they have to apply to the state first. They
Okay.
first have to get a state application, have to get approved by the state, and then they go to the county, and the county can still say no, even if the state says yes.
And where does it say in the bill that the county can say no?
Let's
Do you
see.
recall if it's
In here,
is it on this page?
it's somewhere in this section here.
Okay. Somebody sees it on 61?
Yep.
Got it. Okay, thank
Yeah.
you for that.
Lines 19 and 20. Thank
Okay,
you, Senator.
thank you.
Okay, I've got Senator Vidal, then Senator Hershey.
Thank you, Madam Chair. So I'm rereading this. I find the bakery thing very interesting, like we're gonna zero in, but it actually says a business that has average daily receipts from the sale of bakery goods are at least 50%. So the other 50% could be anything, as long as just 50% is bakery. Makes me wonder who owns a bakery. Interesting. Thank you.
Senator Hershey.
Thank you, Madam Chair. Just going back on page 61, I know we had talked before, lines 25 and lines 26, what distribute cannabis actually meant.
It means that they can sell cannabis products inside the on-site consumption site only. You can't walk out with it. You can't come in, buy and leave. It's like a bar. You go in, you buy your cannabis, consume it there, and then you leave.
Okay, so they do not need a dispensary license. So this is something that is the administration will allow this to occur pending local approval. Is that how that was? Because we did say that was what we just talked about.
I think if you go to the top of the page, it sort of clarifies a process. A person shall obtain an on-site consumption license from the administration before
Okay.
operating a premises where cannabis may be consumed. So I think the first step would be to get approval from and then they have to go to the locals, or they could do it at the same time,
Right,
but they've
but-
got to have state approval.
But that's a separate license. On-site consumption
Yes, it is.
license is separate than grower, processor, dispensary. It's something very specific.
There's 50, I believe, 50 on-site consumption licenses
There's
authorized
50 of
statewide.
these. Now, just going back to where I was talking about before, so distribute does mean that they could sell these products,
Yes,
but it's for on-site consumption. You're not supposed to walk out with it.
Yeah.
And again, going back to what we said before, when we talked about the licensed premise, it's very specific that it says you cannot allow smoking indoors. So if something does have a combination of indoor and outdoor, then we are saying that you could purchase at the on-site consumption place, walk to their outside area, and there you can smoke it.
yes, and providing the locals approve that, local governments approve that.
Okay. All right, thank you.
Let's
Any-
let's go to page 66. And there was some clarifying language here regarding the duties or the roles or what's allowed for a dispensary. And you'll see that they've got even more clear on line 6 that they have to have dedicated service lines to serve only qualifying patients, medical cannabis. And they further went, instead of just saying ensure shelf space, it says ensure that at least 25% of cannabis and cannabis products in the dispensary are from social equity licensees. So it's just more detailed. Let's go to page Let's go to page, okay, if you go to page 83, I was pointing out the amendment offered by the chair regarding no internet sales until July 1, 2025. You'll see that it would be inserted on between lines 12 and 13 on page 83. And then on page 85, there's new language here adding that the tinctures, if you recall, you authorized tinctures up to a certain amount to be at these places that sell hemp products. This was required that these tinctures be tested by a lab or by the administration. So it requires testing of tinctures to make sure they're conforming to the standards in the bill. Okay, and then let's go to page 96. There's two changes here. One of them at the very top of page 96. This regards the distribution of funds that come in from sales tax revenues for cannabis. And the first says the first thing you do is you take the money off the top for administration to do their thing. That's not unusual. This is usually what happens. First, the money comes out for them, and then it's allocated. And there's no change in the actual total allocations. However, you'll see that on lines 13, and this should be 50%, and it will be in the amendments, that the county, except that a county must distribute to a municipality located in the county 50% of the allocation received that is attributable to the sales and use tax revenues generated by a dispensary located in that municipality. You couldn't get it. It's difficult to get any more detailed than this because you have to treat all municipalities the same. So the idea is that if you have a dispensary in your municipality, the money comes to the county, they would have to give you 50% of those revenues generated by that dispensary.
So making sure everybody catches, there was a typo in line 13
Yeah.
where you see 60,
It
it
should
is
be
50.
50%.
Okay. Nope.
No, I was this is, once again, there's a lot of documents, a lot of documents floating around and 50, not 60.
Senator Vital.
Would it be possible to have more than one dispensary in a municipality? Like Annapolis is a pretty big municipality, so you could have more than one dispensary. So then how do they decide to share that 50%? Or is it?
It's 50% of the revenues that come out of that
that
municipality.
okay,
Yeah.
thank you.
Okay, and then the next page, there's no change. It's still 9% tax. Let's see. Oh, and if you go to page 99, there was clarifying language put in here. If you recall, there was a lot of discussion about getting money to the social equity, to the HB2 folks from the business assistance fund. So it just clarifies that these folks are entitled to be assisted with startup funds from the business assistance fund you established last year. I think now we can go straight to the uncodified language in the back. So if you go to page 108, the Senate passed legislation that would say that a grower that was, for lack of a better description, licensed under because of HB2 was entitled to get a dispensary. That was a little too limiting. So there were more than HB2, there were more than social equity HB2 licenses granted as a result of the 2008 legislation. So this to be consistent and again to be constitutional, any grower that was awarded a license in 2018 would be entitled to get a dispensary if they didn't have one yet. It only adds 2 more growers to the list. And there was also language in here regarding processors that they would be put into the lottery automatically without being vetted. If they were a processor who received a license as a result of HB2, that just can't be done constitutionally. So that's out now. So they'll have to, if a processor wants to get a micro grow license, they'll just have to submit to the process like everybody else. And then in the bottom of the page, these 3 sections here relate to establishing the new administration. It provides a budget code, gets them money, and they have to work with the Alcohol and Tobacco Commission to how to collaborate to enforce cannabis laws, et cetera. So that's those are the conferee amendments to the bill. Plus one.
Have a motion and a second for a favorable on the many, many amendments, not that many though. Let me just say, I want to thank the entire committee for your work on this product. I want to definitely shout out Senators Hershey, Kramer, and Hayes, who have been working since January and some since the summer during the interim. Several of us served on a joint work group with the House members. So a lot of work and time has gone into this. And then also want to acknowledge David Smolsky and Sally Robb, who've just done a huge amount of work and think this is something that the voters told us they wanted, and it's taken a lot of work to get to this point. And we all know there's no perfect bill, but we have a product in front of us that I think is consistent with what the voters communicated in their overwhelming vote just a little while back. So with that, we have a motion and a second for a favorable. All those in favor of that motion, please raise your hand. That's okay. I count 9. Those opposed, raise your hand. That is 2. That bill and the amendments as presented this morning receive a favorable report. Thank you all very much. And so that vote will be reported out, and budget and tax will need to take a vote on that same bill. They just did. So we'll see this vote on the floor sooner than we think. All right, thank you so much. And now we're going back to Nathan. You still have your yellow sheets in front of you, so we'll go back to Nathan. Yep, there's more, but wait, there's more. Nathan?
So the next 2 bills on the voting list are cross files related to access to dental services. The bills were the product of an interim work group that addressed a lot of issues. So the bills cover a lot of ground. Here, as shown in the reprints, the Senate bill is amended to conform to the House bill with one exception related to the notice provisions, where amendments to the Senate bill make an additional change, which would necessitate an amendment to the House bill. So I'll describe the Senate bill in more detail and then hopefully be able to address the House bill pretty quickly. So Senate Bill 237, as amended and shown in the reprint, is identical to House Bill 290 as amended. The bill alters the Maryland Dent Care Program to include dental hygienists and establishes a minimum grant amount under the program. The bill also requires MDH to create and distribute specified plain language materials related to dental services, requires the Board of Dental Examiners to publish a searchable list of mobile or portable dental services providers, requires MDH to convene a stakeholder work group to study and establish the establishment of a specified grant and loan program for dental providers, and requires the Department of Health to conduct a study on dental provider participation in the Maryland Healthy Smiles program. So then on to the amendments, which conform the Senate bill to House Bill 290, except for the additional change that I'll note. The Senate bill as amended requires each county board of education, certain family care child homes, and child care centers to provide notice once per year to the parent or guardian of an enrolled child of the clinical need for the child to receive dental screening at certain ages. The once per year requirement differs from the bill as it was passed by the House, which as it came over required notice to be sent within 6 months of specified birthdays. So the chair is offering this amendment. The logic here is that the annual notice would be easier from an administrative perspective. The amendments also strike a provision that would have prohibited the Secretary of Health from conditioning or limiting eligibility for Medicaid services based on an individual's citizenship or immigration status. Also requires a mandatory strikes a mandatory Medicaid rate increase for dental services, and finally requires the Department of Health to study providing reimbursement for services provided to a Medicaid recipient by a community health worker.
Thank you, Nathan. Senator Guile has a question.
Yeah, thank you, Madam Chair. You know, I mean, I like obviously that it was removed that the proof of dental care prior to going to daycare, you know, that we're not going to prevent kids from going to daycare or going to school just because they haven't had the dental screenings that is recommended that they should be having. But what are, what do we now require for any other type of healthcare services, notice requirement? I'm thinking of like an in-home daycare. They got to give something every year. Are we doing this now that they have to give? That you have to have some sort of, I mean, I know that like, you know, my kids have been in daycare, they're in school, obviously. And I know that we have to give, you know, proof of vaccine and proof of, I think there's like an annual physical that's required for daycare. But I mean, for an in-home daycare to get continuing to give these, or even I guess a childcare center, I mean, we've talked about repeatedly how little of a profit margin there is for daycare centers and how expensive it is to run these facilities. I just think that this is kind of, dental care is important, but I do think this is kind of an onerous requirement. And especially given, I don't know what other kind of healthcare services that we mandate some sort of notice be given to parents of like, hey, you should take your kid to the doctor, or hey, you should take your kid to the dentist. That's my thoughts on that. Thank you, Madam Chair.
Thank you, Senator. I think your points are very well taken. The bill as it came over, as Nathan was explaining, the bill as it came over from the House actually had these daycare providers and the schools holding the responsibility to notify each parent 6 months before the child's 6th, 9th, and 12th birthday. And so the amendment that I offered just said once a year, because I thought it would be onerous to try to keep track of each child's birthday and then 6 months before that, remember to send notification. As you said, for some childcare needs, healthcare needs, there is communication about the physical that needs to, and how it goes out to parents. Usually, I don't know whether it comes from the daycare. I do know the schools communicate what is needed in order for students to re-enroll. But because this came from recommendations from a group that has worked for some time to try to increase and improve dental health, I just thought modifying that request to once a year, just giving, you know, basic information saying it's important to see the dentist, you know, was the best that I could come up with in terms of a recommendation.
If I could just have one follow-up. So does it say in here what's the, or I assume maybe there will be regulations that will provide the language of what the notice is supposed to be given? Do we know I mean, we're putting it on the childcare providers to give the notice?
So the bill only specifies that, so to use the example of family childcare home and large family childcare home, it just says that each family childcare home and large family childcare home shall provide notice to the parents or guardian of an enrolled child of the clinical need for the child to receive a dental screening within 6 months of, and then lists 3 specified birthdays. And then it says that the notice required under this section shall be sent out once per year.
Okay,
So
so
it
we don't
doesn't-
know what the language will be, the note, presumably department will, or somehow there will be what the form will be, the language that will be.
The requirement is very broad and the department, there is no specific requirement under the bill that the department develop language for use for this notice requirement. However, they would certainly be possible to develop a 1-page form that would meet the requirements of this and then post it online.
Okay,
If that
all
were
right,
something the department wanted to pursue.
all right, thank you, Nathan.
Vice Chair.
I just have a question for Senator Gao. Your children are in daycare or,
Well, they have been
okay.
They have been in daycare in the past.
Okay,
Yep.
but so the letter about seeing their physician, are they?
They don't have, there's no letter. It's just that for them to enroll, like they
Oh,
need
okay,
to
well, that's-
have it. It's a requirement that you have to provide it along with their vaccine records. And then you'll get an email later saying like, hey, we don't have all your required documents for, you know, so you need to make sure you get this. And it's a form, you know, an MSDE form that
I would just think.
you give
just
to the
put
doctor
it-
to fill out, and you give them proof that they've gotten their vaccines and everything.
So I guess it's, as Nathan said, it's broad enough that they can just put it on in a newsletter.
And
Really.
in a newsletter, just that simple like notification, that not to the
They
individual
need to be
parent.
notified once a year.
Yeah.
So
Okay,
Senator Reedy.
Madam Chair, just to be clear, they can be notified in a newsletter. That would cover it for the childcare centers?
I can't, the bill does not specify how the notice is required. And so
Thank you. I gotta tell you. We've done great work on this bill because it was. I've had, it was not in good place when it came in. I really don't like another mandate on home daycare providers and childcare providers. We're literally talking, and I know this is just like one notice. And they probably already do a yearly notice for other stuff, so they can just add this to it. But Senator Giles, right, she has children that are in, I've had children in. We're literally having a whole thing this session about how we don't have enough access to childcare. And I know this isn't going to restrict access, but it's another requirement on people that are doing this. I don't understand. Parents know their kids need to go to the dentist. Sometimes they don't, and they're not good parents. But that's like, if they're not doing a good job getting their kid to the dentist. I'm just saying, like, I'm probably still going to vote for this bill after this rant, but I just want to say, because we did amend it heavily and I got to be.
I'm just going to interrupt you, Senator, and say my 1-year amendment is just that. It's an amendment that we can either take or not. And if there's another amendment, I tried to.
Oh, I'm
take
not
it
complaining about your
No, no, no,
amendment. I mean, you're trying to scale the bill down further. Yeah.
Deep breath, Senator. Take a deep breath. Okay.
Can I just say why I'm upset? I just want to say why I'm upset. And I've had this folks contact me. I've had folks in my office about this. A lot of good people, a lot of good folks in the dental community. They're like, hey, we've been working this out. It's like, yeah, we're still working it out to have another mandated requirement. And even with our school system, it's a little different because we want kids healthy when they come to school, which is a good thing. But even there, we're piling more and more on the education system and on childcare for jobs that the parents should be doing. I have less of a problem though requiring the school systems to do this than I do these private home providers. I know. All right.
Let me go to Senator Lamb and then Senator Hershey.
Thank you, Madam Chair. Without the level of frustration, I also share my colleagues' concerns there. We have a home daycare provider in our neighborhood. That's not where our child goes to, but I know from even ours who goes to a larger, more established corporate childcare center, they're struggling. All of them are struggling. We've had toddler rooms that were closed and they had to get consolidated. I think this requirement really just kind of not going to be the straw that breaks the camel's back, but there's a lot of requirements on daycare providers that are closing and struggling as is. My question for council is if a daycare center, for example, a home childcare center forgets to or just misses that annual notification, is there some enforcement there? Could they lose their license, or
there's
I just don't want to see more childcare centers close, I guess.
There's no enforcement or penalty provision described in the bill.
So if they happen to just miss the child with that annual notification or if a newsletter kind of announcement in there is sufficient, they shouldn't lose their license, right, over this.
The bill is silent on that subject. I can't say if due to the position in which these provisions are codified, that the department would say that, you must comply with all of the requirements of this subtitle in order to qualify for relicensure. I simply don't know. The bill does not address that within its scope. It simply requires the notice to be sent. The impact that the department would interpret that to have on any licensure, I cannot say without contacting the department.
Right. Yeah, no, I get, and I appreciate the candor. That just gives me some more concern.
Yeah.
Thank you. Senator Hershey.
Thank you, Madam Chair. To maybe move this along.
Sorry.
Could I offer a conceptual amendment that would strike the notice requirements in pages 2 and 3? I think that would satisfy a lot of the concerns that have been brought up. Yeah.
Okay, I have a motion and a second for a conceptual amendment. The sponsor says she doesn't have a problem. Can I call on Senator Mounts and then we come back and do the vote on that amendment?
Yes, ma'am.
Senator Mounts.
I don't.
Just one sec. Let me do that and then we'll go back. I'll re-announce the amendment.
I don't have a whole lot to add, but I get it's like the end of session and you read this, but I know kind of the essence of what the intent of this is is pretty much just to make everyone aware that you're supposed to get these screenings for children. And I think the idea of putting it in law is just a way for the dental community to try to formalize this rather than on a patient by patient basis, because their message only gets to the patients that they see. And so I think the issue is you're putting this in law and, oh my gosh, the government's coming to get me. And I don't think there's any intention behind that. However, when you put something in law, I get the concerns. And if there's an amendment to strike the notice requirement and that sort of thing, that's all good and well. But for 20 plus years, dentists have been trying to get people in general, just the general public, to be aware of the importance of screenings and things, because they oftentimes, if you miss your screenings, by the time you come to a dentist, it's limited in what they can do to help you. And I think that's kind of missing from the discussion in the bill, because I know you read this at the very end of session. It's like, oh my gosh, what are they trying to do? You ever watch Seinfeld about the dentites? And yes, I won't do that. But as the son of a dentist, I'll just say this is just a way to formally make sure there's a broadcast of public awareness. So thank you.
Thank you, Senator. Senator Guile.
I'll be brief because I think I've already given sort of my comments, but I just to say, I mean, I do think that dental care is important. I'm just concerned that we're putting this requirement on childcare providers in order to do this. I think there are other ways the dental community can advocate, can do, for public health campaigns, go into schools, talk about the importance of it. I mean, I think that there are other ways they can do it. I think that this is just putting the burden on childcare providers when we've been talking about how hard it is right now in that industry. So I appreciate the motion to remove the notice requirement.
Noted. So what we're going to do is, rather than voting on a conceptual amendment, we're going to give council time to actually put the amendment together for us. We'll take it up at our next voting session. We do have one additional bill on our voting list that we are joint with budget and tax. And so we want to take that up, so we're not the hold up on that bill. So I'll ask Nathan to walk us through that. And then the next time we convene, we can take up the dental amendment. His conceptual amendment was to remove the language requiring notification that goes out from the childcare providers in schools. Okay.
So the final bill then is House Bill 418, which is the cross file to Senate Bill 283, Budget and Taxes Primary, Finances Second. The bill establishes the Behavioral Health Workforce Investment Fund to provide reimbursement for costs associated with educating, training, certifying, recruiting, placing, and retaining behavioral health professionals and paraprofessionals. The Department of Health is required to administer the fund and submit an annual report. The fund is subject to audit by the Office of Legislative Audits, and the the Healthcare Commission, in coordination with specified stakeholders, must conduct a comprehensive behavioral health workforce needs assessment. And that assessment must recommend an initial allocation to the fund and identify which programs the allocation would support. So on the cross-file bill, Senate Bill 283, Budget and Tax added the Department of Labor and the Career and Technical Education Committee to the list of entities that MHCC must coordinate when conducting the assessment. The House bill, which is before you now, includes that amendment and makes two additional changes, moving back the due date of the assessment and makes a corresponding change to the date by which the assessment must be reported to specified committees of the General Assembly. It's not a concurrence.
So
this is the House bill.
Then just move favorable.
I have a motion and a second for a favorable on House Bill
As
418
amended.
as amended. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Stay tuned for future announcements. Thank you all very much. See you on the floor.